As we focus a bit on the importance of mental health and support for men in this month of June, where we celebrate men's health, I welcome the president of the Single Fathers Association, Rhondall Fields. Good morning to you, sir.
Morning, Ruckus. Thanks for having me as usual.
How are you doing this morning?
Well, good enough. Fair to find. Here's this again is a men's mental health month.
You
So
didn't know? You
something to
didn't know?
smile about, I imagine. Huh?
Well, I feel like
No, no,
this is
no.
a good month to have
Yeah.
these conversations. So, as it is Men's Health Month, do you think that men still struggle to get their emotions out, to at least be able to express them comfortably in our society?
And that's the thing, and I mean that's why I was being a bit sarcastic, right? Um, it's not about men struggling alone. I won't say that men don't struggle as well, but have we created a space that allows men to express freely? Have we created a society that encourages men, a narrative from the public space, from the ministries that are in charge? That we had Ministry of Gender before, we now have it absorbed into the Ministry of the People. What are the plans of the ministry this month? Yes, we'll have many talk shows that we talk about the mental health issues that a number of men going through. But what are the plans? And that's why I had that level of sarcasm. What have we instituted? Not only for adult males, but for the younger boys. What have we done in the schools? What are we going to do in the school? What is a well-known program that has been drafted and created after we realize that men are struggling with mental health issues? After we have the statistic that we know that 4 in every 5 males are victims of suicide. We are up to 84 percentile right now, the victims of suicide. What's the plan other than talk, other than to talk about the issues that men have? And that's the thing. If this is a month that is attributed to male mental health issues, I would love to see a rollout, and not just a rollout from the NGOs, but a rollout from the ministries, the Ministry of Health, Ministry of the People, as I said, and of initiatives that would improve the lives of males, whether they be boys or whether they be adult males as well.
Now, I have a couple of questions based on what you're saying there, Rondell, because I remember we've had some programs like the Empower programs where they would have gone and invited men and spoke to men and did this mentoring process with men, and that was funded, if not put on by the ministry. We've seen the Ministry of Community and Social Development where we had the mediation services, where there's a safe space for men to come and express themselves, or it's supposed to be at least. And we see these different initiatives. But are you saying that they are not enough to make us comfortable with with the work that's being done on behalf of the government? But is it only the government's responsibility, or should it be an all of society approach? Do we expect the government to facilitate all of the mental health needs of men, or is it that you just think they need to be doing more?
Of course, it could never be the government alone. It needs to be a multi-sectoral approach. But what I'm talking about is going out into the communal spaces, creating the narrative from top come down. And that's critical and that's important because it shows a level of concern. Once you see that level of concern from the hierarchy come down, then it definitely trickles down. But you most times see it coming from the bottom go up. And most times the bottom is not resourced well enough to really execute something that is meaningful and something that is sustainable. So yes, we mentioned things like the mediation centers, but I can't say the mediation centers is a place that you will find someone there that actually deals with some of the psychosocial needs of men. They may be there to have conflict resolution if they have an issue with their wife. But an additional to that as well, they may be there, but how well do we advertise them? How well do we promote these institutions? We've built a lot of buildings. We've built it. Some may say, Mr. Fields, we have psych centers all through Trinidad that men could go to. But have we made them male-oriented? The main fact you call it a psych center, you really not trying to attract a man to go there. What about calling it a male empowerment center? These kind of things. So putting infrastructure there with very poor strategy makes no sense. People won't utilize what you have there. And that more so than anything else is the issue I have with the governments, or issue I have with ministries. Yes, we create things. Yes, At that point in time, we put them out there, but we didn't put any strategy, any thought. And that says to me, was there the right level of concern in the first place when we was coming up with a strategy? Did we come up with a strategy with a real, true intent to get people to utilize this resource, or did we just do it because we was ticking a box on a list of things to do?
Rhondall, tell me, in your work with men and with fathers, tell me what are some of the most common mental health challenges that you would say comes up in the conversations or in your dealings with men?
It's always depression, and what we need to look at is what sometimes drives a man to mental health issues. What are the common things, the common triggers? One for sure is financial problems. We created in a society where we understand the value of a man being the protector, the man being the provider. Whether we want to say those are stereotypical norms and whatever, at the end of the day, a man knows that he must be a protector because of his physical composition. If he's in a home with his wife and his children and a bandit gets into the home, it's only obvious he's the strongest one amongst them. He has to be able not only to have the right strength physically, but strength mentally. Mm-hmm. These are some of the psychosocial issues that men have that women do not experience during this society or era of home invasions. When you speak to many fathers and men now, married men, they have a serious concern because at any time crime could enter into their home and they will be called to lay their life down for their family. You understand? Financial, as I said, we had to look at a job opportunity. A man has to find a job, you know. A woman, I'm not saying that she still, in my view, has a choice. It's easier for her to find someone who will be willing to take care of her. We as men not going to find a woman that easily that will be ready to take care of us, you know. And that is a reality no matter who don't like it. So a male knows he has to be employed. He has to work. Look at the type of employment that men sometimes have to. Look at the construction sector. One of the most arduous out there. That is because of our male physical composition. It is expected that we are the ones that are most dominant in that field. We are the ones that will go for that field more than anybody else because of our physical makeup. Look at the security services, police, fire, defense force. Yes, they have a contingency of women, but at the end of the day, because of our physical makeup, it is expected that we are the ones that are thrown out there. So there are some things that we are born biologically that we are going to always have to do, and tribute must be paid to that. When I say not just tribute, you must show a level of concern. What does a man working in this industry go through? Do we have things within that work system that could help him alleviate some of these stresses he may go through? And we really don't have it for men. We're still fighting for paternity leave because we see it's insignificant. Another issue is marital issues, where there's separation, where there's divorce. Just yesterday, Ruckus, I went and meet a father who, when we went and do all the groundwork, the investigative groundwork and gathered information, he was hoisted out of his house with an allegation made against him for domestic violence, banned from seeing his children. But when we went to the schools attest, and these are women in the schools, teachers, about the type of man he is and the type of father he is and the type of parent he is and the type of support system he is to the schools themselves. And this man is living in his car right now because an order was made and he was not there to give his side of the story, an ex parte order. So these are some of the stresses that men go through unjustly, and not just unjustly, men go through because we are men and socially there's a perception of men. So we must understand as a society there are specific things that can lead men and that is currently leading men to serious mental health issues. Now, physical health. Go ahead, sorry.
Let me just interrupt you here for a second, because you mentioned these things and definitely very, very valid points. But I want to know, in terms of, all right, so even if we were to say, let's say you use the construction sector as an example, right? Let's say they were to set up the systems in place where we have, let's say, employee assistance program or whatever other psychosocial support that men need. We still have a stigma of men not willing to ask for help. How do we change that part of it as a society?
And Ruckus, to me, that is a lie from the pit of hell. Because why do they ask me for help? How can they find me and ask me for help continuously over and over and over again? It is because publicly I have presented the right narrative to men. Publicly, I have told men that I understand they have concerns as well. Publicly, I have allowed men to see their vulnerabilities as well. So they have become comfortable to express their most vulnerable situations with me. And I am just a man. If this same level of concern that I spoke of before was shown from the hierarchy, as I said before, come down, you would see the men that you say are unwilling so to do. Men are willing, men are stressed to speak, but they just believe speaking in every quarter doesn't mean they're going to be heard from that quarter. Sometimes they speak in spaces in work and they get subpoena or they get in problems for saying something that they really feel. They go on Facebook and make a video of them really hurting. Social media bullies them. So we have sometimes our society is created in a distance and in a space or in an environment that we have not facilitated men to speak openly and freely without
Rhondall,
some label being attached to it.
when these men come to you, Rhondall, do you also advise them on how to seek professional help when it comes to their mental health? And do they take that advice?
Many of them are willing, and we try to get them to spaces where we could get pro bono. But most of these men who are going through a lot of these challenges don't have the money to go to a psychiatrist. You send them to, and sometimes the same psych centers, they say that they are not available. When you send them there, sometimes it's a long, drawn-out process before they get to see anybody. So it's not as that we have these places and we're sitting and waiting, And then when you ask them, they say, well, men don't really come anyhow. So sometimes, in other words, we don't know when they will come. So that's why we haven't put something in place that is sustainable. That is the kind of excuses that you hear. So really and truly, we really have to meet them in the best way that we can. Actually, yesterday we were dealing with a man who was thrown out of his house and living in his car, a house that his mother left for him, with an allegation made against him, just an allegation, without him being there to defend himself, he being the caretaker of the children and also the provider.
Speaking of that, Rhondall, how does the mental health and the mental well-being of men affect their ability to be a good father, their ability to take care of their children and to be that responsible figure in their lives?
Of course. And I mean, let's look at it as someone who's been doing it. It could also be demotivating to continue to do so. That is most times when we meet fathers who've been doing the right thing. And then they bounce up injustice or bounce up some type of hardship where they cannot find redress. Most times they say we should have never been doing it like this in the first place. It was a waste of time, a waste of effort to be actually being opposite or kicking against the grain. The grain are everybody saying fathers are deadbeat. Doing the right thing to them, they said, no, we are demotivated to continue doing it. So sometimes I'm saying like failures of the justice system, failures of proper regulations and these things in the workplace are causing are actually the things that are causing some of the mental health issues that some men experiencing as well. So you have to examine these things throughout society, the way we treat men. Some of these things are actually causing men's mental health issues. Also, the public health system. I think I've spoken about it again. One of the things that creates a lot of mental health and anxiety is when you find out that you have a physical ailment. You have cancer, or you have a kidney problem, or you have some problem. But in the design of our public health system, there are very little triggers to encourage men to actually do checks on themselves. And everybody will say, yes, have a personal responsibility. But if you examine the public health sector, you'd realize there are a number of triggers, and not the woman's fault, based on their biological makeup, that they have to go to the doctor and they get other things checked at that point in time as well. So it's easier for them. But for men, the only trigger they have is pain. So that's why we have to be able to sensitize, to encourage, to make the drives, from as young as kindergarten, start teaching young boys the value of self-care, of mental health care, of physical health care. Don't wait till it later develop, possibly third and fourth cancer, for you to now decide to go and take your first check. Women have the opportunity, females have the opportunity. When a girl gets her first period, she gets cramps, they make her carry her to a doctor. He sees about the period, but he checks everything else. When they're doing their pap smear, they go to the doctor. The doctor deals with the pap smear, but he checks every other thing. I don't know if you've ever accompanied a young lady to a pap smear. I have. And I'm telling you, the doctor checks every other thing as well when he finishes. When she becomes pregnant, the gynecologist, he deals with the pregnancy, but he checks every other thing. If your liver working, your kidneys working. And we men really do have triggers other than pain.
Other than pain. I would have to say I definitely agree with you. Rhondall, unfortunately, we are out of time for this morning. However, I do want to ask you to leave a message for the men who might be looking on this morning. Maybe they feel like they're at their breaking point. Maybe they've been pondering on all these things that you're talking about here and hearing all the challenges. But what would you say to the men looking on this morning, especially as we're in Men's Health Month?
Right? I would like to encourage men to continue to have courage. There's somebody that cares. And I just want to use, as I said, that example from yesterday. That gentleman told us, he said, Mr. Fields, if I didn't get on to you and your group, my next move was to end my life. And I know it have many of the men out there thinking that is the answer. And you know what relieved that man's thoughts yesterday? When I informed them of what other people in his community said about him, when I informed them of what strangers in his community, what the teachers in his school said about him, it broke him down to literal tears that people in his community valued him. I'm saying to you now, men, even within your family, if you're not feeling valued, there's somebody in your life that values you. Some co-worker, some pumpkin vine family, somebody you're possibly assisting every day, and you're just doing it out of the goodness of your heart. You are valuable, you are special, and if you think you're having thoughts that are not healthy or not beneficial to yourself, reach out to help. Whatever is it through the Fathers Association, whatever it's through a church, a mandir, a priest, a pundit, a pastor, open up and ask somebody to assist you. You are male and it's okay to be male and to be vulnerable.
Thank you so much, Rhondall. Enjoy the rest of your day.
Thank you, my brother.
Take care. Ladies and gentlemen, that's Rhondall Fields, the president of the Fathers Association, joining us to share his thoughts on Men's Health Month and, of course, men's mental health. We take a quick break and we come back with more on the Now Morning Show.
Mr. Happy Papi, Mr. Happy.